Hello, everybody, and welcome to this roundtable discussion on NCLEX-RN exam preparation. Tim Warner here from PearsonITCertification.com, and we're joined by three of our key authors in this space, Wilda Rinehart, Clara Hurd, and Diann Sloan, all Pearson authors and all from Rinehart's and Associates Nursing Review. Thanks for joining me today, ladies.
Thank you so much, Tim. We're glad that we're able to be here.
By way of introduction, probably the best way to proceed would be to just ask each one of you in turn to briefly introduce yourself to your audience.
Okay. I'm Wilda Rinehart, and I'm the president of Rinehart & Associates, and that's a nursing review that's been in existence since the early 1980s, and I know that makes us sound like we're really old, but we're really not that old. I have many years of experience in teaching med-surg. My expertise is med-surg and obstetrics. I have a master's degree with a family nurse clinician specialty, and have been working with Rinehart & Associates, like I said, for the last several years.
Clara, how about you?
My name is Clara Hurd, and I am a nursing instructor, an adjunct instructor for Mississippi University for Women. Mm-hmm. I also work with Rinehart & Associates. I'm co-authors of these books. I do nurse education consulting, and I have over 30 years of nursing experience. My main experience has been in med-surg, orthopedics, oncology, intensive care unit, and I taught for over 25 years.
Wow.
In associate degree and baccalaureate nursing program. And I really feel like that nursing is a calling, and this has been a very special opportunity to be able to share my information. Thank you.
Yes, thank you, Clara, very much. And Diann?
Yes, my name is Diann Sloan, and my background is primarily in pediatrics, neonatal intensive care, also in psychiatric mental health nursing, as well as med-surg nursing. Like Clara and Wilda, I have about 30 years nursing experience in nursing education, as well as working in a staff nurse capacity. And I am in the review. I teach the live review with Wilda and with Clara, and I'm also one of the authors. My nursing education began in associate degree nursing, and then I continued on for my BSN and my master's, and I have double masters in nursing, as well as counseling education, and my doctorate is in counselor education, with an emphasis in child services.
Excellent. Have you ever, and this is a question for three of you, semi-hypothetically, have you ever added up your collective years of experience? Because it seems pretty amazing from my end.
Well, we hadn't really thought about it. We don't want to add any years.
I did one day, and the students kind of looked at us like, okay. It's like probably close to 100 years now.
Indeed. So to get into the meat of our discussion, we're here to discuss your three most recent books for Pearson IT certification. One is NCLEX-RN Exam Prep, 2nd edition, which published the 1st of September of 2010, and then two upcoming titles, NCLEX-RN Exam Cram and NCLEX-RN Practice Questions. Both of those are slated to pub in the October to November 2010 timeframe. And my first question, I think this goes to you, Wilda. All three of you have a real loyal following as authors and as teachers. How did you come to become a best-selling author of nursing exam prep books?
Several years ago, Pearson noted our website, NCLEX-Review.net, and Pearson and Q Publishing approached us regarding writing for them. They noted that we had NCLEX reviews and that we were educators with many years of experience. So based on that, they asked us about releasing or writing the exam cram book. So right now we're into our 3rd edition of the exam cram book. And as you said, the exam cram books are very easy to read. I believe that students learn best if they understand the material thoroughly, and then they can put the practice questions into action based on the content that they've learned. The prep book followed about 3 to 4 years ago, and like you said, we're now on our 2nd edition of the prep book. But basically what they did was they found us on the website, and since that time we have worked with Pearson and with Q Publishing with the NCLEX reviews. I think that students, like I said, learn best by seeing materials that's very easy to read, and that was what we intended when we came up with the book. So that's how it basically came about.
Now, for those in our audience who may be new to the nursing profession, could you please describe the NCLEX-RN exam?
The NCLEX exam, or the National Council Exam for Licensure of Nursing, NCLEX actually stands for National Council Licensure Exam, is a licensure exam, and it is intended to measure the safe beginning practice of nursing. So I think one thing we need to point out to the people who read the book and do the book is that they don't have to be acute care nurses, they don't have to be experienced nurses, but they do have to have a basic knowledge and skills and ability that indicates that they are safe beginning practicing nurses. Now, several years ago, I think it was in 1994, the NCLEX went from the paper-pencil exam, and it changed to the CAT exam. Now, CAT stands for Computer Adaptive Testing. Prior to that time, candidates that took the test all got the same questions. We all came together. We sat at large tables, cafeteria styles, and every candidate took the same number of questions as well as the same questions. Now, in 1994, when the CAT exam was put into play, that was so much better because the student is able to answer questions dependent upon their ability to answer those questions. So to explain it a little bit, when a candidate starts out on the test, they're all at the pass point. As they answer questions, the computer feeds the questions to them dependent upon difficulty level. If they answer the first question correctly, they will get a more difficult question. If they answer the question incorrectly, they will get an easier question. Now, back April of 2010, the test plan changed somewhat. They actually took 3% for reduction of risk, and they moved it up under manager of care. And I thought what I would do just a little bit is to talk to the audience about how the NCLEX is laid out. It's laid out according to client needs, also Bloom's taxonomy, and a lot of the graduates may not know what Bloom's is. The test questions are divided according to knowledge, comprehension, application, analysis, or evaluation. Also, there are integrated concepts that are tested throughout the exam. Now, the student can go to and should go to the National Council's website, that is NCSBN.org. For a detail of the test plan, they can actually view and print out the student copy of that, and that will give them some sort of a breakdown of how the test is laid out. Now, let me just mention that under the client needs category, I mentioned about the safe, effective care environment. That is actually divided into management of care and also safety and infection control. That's a really big thing that the student needs to know. It gets a large portion of the exam. Health promotion and maintenance gets a lesser part of the exam, and then so does psychosocial. But the student needs to be aware that they have to pass each area in order to become licensed. The last section is physiologic integrity, and that is divided into basic care and comfort, pharmacology, and parenteral therapy, and I think that all students feel kind of weak in pharmacology. I'm not talking really about the math calculations at this point. I'm actually talking about pharmacology. So the student needs to be well aware of different drugs, and I usually tell people that they should expect to see medications that they do not know what they are, and when we do the NCLEX review, and I've done it in the exam cram book and also the prep book, I get students to look at the categories of the drugs because the nursing implications and side effects is very similar through those. Now, about 80% of the time, the student can look at the generic name and syllables within that generic name, and that will help them to make an educated decision or, if you will, an educated guess as to what the answer may be. And I think Clara's going to talk about that later on. Reduction of risk, as I said, they took some of that away and they moved it up into that manager of care. So the student would expect to see a lot of what can the RN do, what does the LPN do or the LVN do, and what does the nursing assistant do. Also, room assignments and priority of care is really, really important. The student can expect to see several different kinds of questions. Of course, the multiple choice questions that they're very accustomed to. Also, alternative items.